Good morning, Chris.
We wanted to start out with the results last night. There were only 13 tests that were ran by public health, and previously there were 20, there were 40. I'm just kind of, if you could explain why there was only 13.
Yeah, actually we tested a total of 16, but the ones that we had to rerun or their follow-ups, there were 3. So that was already counted in the individuals that were tested. And as you know, 1 tested positive, 12 tested negative, and then the remaining that we did was for the CNMI, because as you know, the US API, we being part of the selection of our island, Guam Public Health Laboratory, we're able to also provide testing for the CNMI and the Pacific Islands. So,
how many did you guys run for CNMI?
Yesterday we ran a total of 4.
Okay.
4 or 5.
So you basically ran one 20 test load and...
Yeah, there were 3 follow-ups. That means we reran them, and they were run before, so that's why. Now, in regards to the reason why we only had that much is also because those that are asymptomatic, as you know, these are still being prioritized. So the ones that are more critical are run first.
Right.
And we also have the diagnostic laboratory that we are also sending asymptomatic specimens through them, which they're running it off island. And those are the ones that are at the lower end of the priority listing.
Right, Linda. Thank you. Because we were wondering about that, and so that was why there were 20 run, but so we're sending off DLS. We spoke with Dr. Akamoto yesterday. He said that commercial testing, it's up and running this week. So people, how about the central public health that you guys just opened recently? How's it going there with testing?
Yeah, it's going very well, actually, and we're also expecting more test kits. Actually, we just received yesterday another box, so that would be about 400 more test kits. And I just received word today that another 4 boxes of the RNA extraction. This is the kit that will help us to do the testing for the coronavirus, is already on its way from FEMA. And we're just expecting that. It's already flying through at this point in time to California. And once it reaches California, it should be heading towards Guam. So it should be soon. And then the U.S. Department of the Interior also funded all the U.S. APIs, that's the Pacific Islands grant. And what happens is Guam received a total of another 460 boxes of another type of testing, which is through the Gene Expert machine. It's another type of machine that the department also has. And so that equivalates to about 4,600 more test kits for another type of machine, which is the Gene Expert. And so that is already in motion, and hopefully we'll also have with that 4,600 nasopharyngeal swabs, test kits, swabs, and then 1 box of the quality control kit. And so that's what we're getting through the support from the Department of the Interior through the Pacific Island Health Officers Association.
Okay, so when we get all this equipment that you're talking about and supplies, are we going to see more tests being run?
Yeah, it's not an equipment. These are all just test kits, because we already have the equipment at our laboratory.
Right, yeah.
Yes, we have 2 machines right now. We have the ABI 7500. That's the one that's running all the coronavirus test kits as we speak, with all the test kits coming from US CDC. And then the other one is a machine called the Gene Expert. And this machine is also now with more testing for coronavirus. And so once we get all this, then we'll be able to have more capability of running both the 2 machines that are located at our Guam Department of Public Health Laboratory.
Linda, we know that this has been something that you've been telling us for a few weeks, is that you've been out there trying to build our testing capacity, and it looks like we're doing that. What is then are we going to see a mass testing or
today?
Or any, when we get, because you said we're getting 4,000 some.
Yeah, 4,600 for the Gene Expert. Yeah, and today actually yesterday it was delivered another box, so we have about 400 more test kits. So we are still going to prioritize, Chris. The priority is always going to be those that are in the hospital, those that are hospitalized and they have the symptoms. And then the second, of course, the other priority groups are those that have chronic conditions, comorbid conditions with COVID symptoms. And then, of course, the healthcare workers with COVID symptoms, because we need them to continue, and we want to make sure that they're protected and that they don't, if they are infected, we don't want them to further spread anything. And so that's why they're very critical. And so all these top priority groups are going to be the priority first, and then if you get anyone else, again, whether they're asymptomatic, right now the asymptomatic, we're utilizing DLS to send them off island, so that, that will still be done. Right now, I've already instructed DLS to go ahead and proceed with the Medicaid, MIP, and uninsured patients, and those with insurance, of course, we're going to try and bill them through their insurance provider. But in the meantime, that's what's happening also. So as you can see, we ran these tests. Today we're going to run another 20 in the morning, and we're anticipating that more will arrive. We have about 13 left that are still here, but again, when the day starts, we get more and more coming in from the other clinics and also the hospitals, both Guam Regional Medical City and GMH. And so again, when we get more, we prioritize whatever comes in, and then we run them. Okay?
Okay. I wanted to also just gosh, I lost my train of thought.
Let me ask you then, Linda, because I had a question. So, for the record, we are still on the limited priority testing group.
We're still doing the priority testing group at this point. Yes.
Okay.
And then that is all because, again, the physicians group, the advisory group that makes that criterion, again, specific for Guam. Because now that we're receiving test kits locally, it's up to us to decide how we want to do our testing. And so that's why the physician groups, and these physician groups are representative from Guam Regional Medical City, a physician also from GMH, and also the other private clinics, and of course our public health director as well. And so they all come together, and then they develop all these criterion. So that's what we're following.
Right.
I wanted to ask, because this is an issue that's been brought up a few times on this show, and from the mayors, and then just recently from one of our callers, in terms of why can't we release the names of these villages? I mean, we're identifying the Iglesia Ni Cristo Church, Hafa de Bingo, but not breaking it down from village by village.
Right, because we're still doing the contact investigation, and again, we're trying to piecemeal all these different types of contacts that are occurring, whether they are household contacts or they're also contacts by the community. So we're trying to identify, are there household spread, which we already know that is happening, and also community spread within the community, meaning they don't have to necessarily live with each other, but they're exposed, whether it's because they're seeing people in congregate, meetings, like what we have experienced with the Hafa de Bingo, and also with the Iglesias Ni Cristo, different types of church settings, which are in different locations. And the answer really is we're still putting everything together. We're getting piece by piece, and we're just trying to put that together. Realizing we do report where they are located, but just in the northern and southern. And I really think that that's why we're getting a lot of calls, and not only are we getting calls, we're getting also information from people that are testing positive, and then our surveillance team and our investigative unit first is the first to start the investigation for a positive patient. And then after they do their investigation, then we also have our other units, which is the surveillance team that do the surveillance and contact follow-up. And then after that, we then have the isolation and quarantine units within our department. So we're putting all this together. I realize that a lot of people are asking, which villages we have, the information. But again, we're just trying to track all of them and trying to get a cluster group of study that we can gather together. I think that's pretty much what we're trying to do. So I hope that answers your question.
So Linda, you're saying that we have the data, the village data, it's just not being released at this time. So you anticipate that data going public anytime in the near future?
That will be a decision that I would have to meet with my staff, and then we'll make that decision. But right now we're still doing the clusters and trying to do the study as far as where the index case is coming from and how the community and the household contacts are occurring.
So since you are able to release the Iglesia Ni Cristo, so there is for sure a cluster of cases there. And how many? What constitutes a cluster?
Well, clusters meaning you have one person that gets infected, and then, of course, there may be other people that are infected, and then for sure we'll know when their test comes out positive, then we can identify all those people in that setting or that congregate group, right? And so that's how what we call a cluster, meaning they're all gathered together, and then they're all linked to that specific location or that person that happens to be positive, and who else was infected by that individual.
So how many in this cluster at
Iglesia Ni Cristo?
Yeah.
Okay, we're going to have to, I can get that information, but I don't have it right now.
Okay.
But I can get it for you, and I can also provide that to you like I always do when I don't have the information.
What about the Hafa-Adai bingo? We hadn't heard anything else about that.
The Hafa-Adai bingo right now, okay, their 14 days has been over, so if they haven't gotten infected, then that's fine, because a 14-day time frame when they all gathered is up. So that's why they've been removed from our list of the ones that are very critical to monitor. And so that's the reason why we're not going to include them in our announcement, because we already announced that previously.
Okay.
And so their 14-day of quarantine, whether they're going to do the home quarantine, it's already up. So we're not too concerned unless they gathered elsewhere and then they're linked to somebody else that could be infected. So again, it depends. If these people keep roaming everywhere and they're not following, what we're recommending is home isolation and also home quarantine rather. And if they are infected and they're mildly infected or asymptomatic, home isolation, or if their home is not conducive for home isolation, then they go to our GovGuam isolation facility. So that's why we want to make certain that people are following the social distancing, people are following all this, so that this will help us to delay or prevent the further transmission of the coronavirus.
Linda, what about the children testing positive? I mean, that was a big announcement at the press conference.
Yes, it was. We announced that yesterday. That is correct. We have one. Yeah, the age range, right?
Yeah.
The 0 to 9, that was a 1-year-old baby, and that was through a household contact. And then the 10 to 19-year-old bracket, there were 5, and of that 5, 3 were also household contacts, and one was travel related to Honolulu, and the other one was a social event.
Were any of these
what social event? Because I thought we weren't having any.
They contracted it from being in a social gathering.
Wow.
Are any of these connected to the quarantine facilities?
We have to, if they're going to be connected to the quarantine facility. First of all, if they're test positive, right? If they are in quarantine, then they'll be moved to isolation. We've had other cases. Remember, I went to court for March 19, Philippines, right? Okay, that event that happened, we did see about positively 3 that were tested positive from the quarantine site. So we had to move them out of the quarantine site into the isolation facility. And then there was one contact that communicated really very closely with somebody that was positive in the quarantine area. He was also under quarantine. So we delayed him from leaving, so we just extended his quarantine. Now, if he experienced any symptoms, then he would be also moved to the isolation facility.
Linda, I'm trying to get a pediatrician on the line, but I think what parents now are kind of wondering, since yesterday, is how do kids do against COVID-19?
Yeah, actually children do very much better than those with comorbid conditions. That's what we're seeing right now. Every case is different, right? Depending upon if that child also has other conditions. So it's really if they don't, then the likelihood that they're going to do fine will be there. But I'm not an expert in regards to physicians, so I would divert all those questions to a primary care provider. Okay. But just answering your question also about we have 92 cases with no travel history that I reported yesterday. And today I'll report more data that is updated as of yesterday's testing. But imagine 92 that had no travel history, and of that 92, we're finding 24 have household contacts, okay? 11 are community contacts, 13 are healthcare contacts, and of that 13, 5 as a patient, 8 as a healthcare worker, and 44 did not report any contacts at all. So we're gathering all that information and we're providing it to the public. So
that's the evidence of the widespread community spread, right?
Yes.
That could be like
correct.
Going to the grocery store.
Yeah, and so this again, going back to what the governor's, one thing she's been very consistent on is stay home, stay home, and this is why we have to stay home, because the virus is out there. It's not only out there; it's in our homes, and we're giving it to kids, and we're just giving it to everybody.
That's right. And when we do the investigation and we find a patient that's very much positive, whether it's a parent, we do have to examine the household, how they live, and if it's not conducive, like they have other family members, like an elderly that lives with them, or let's say another parent that has a comorbid condition, we don't want to leave that individual in there, because then they're susceptible and they're more at risk, because of their comorbid conditions, that we don't want them to be isolated in that particular home. So that's why we move them. Okay.
Okay. I just wanted, before we let you go, we wanted to ask one more time, because we did try to reach out to Tess Archangel, because she's the one who handles the
food stamp, the SNAP,
right. And so for people that we're looking at unemployment numbers right now, currently at 16,000. Where do they go? What can they do to apply?
Yes, Tess will have all that information, but they can call. We'll have those numbers available to the public. They can call the Division of Public Welfare, and I think what we'll do is I'll give you all the numbers of the different locations, and then we can have that readily available, and we'll provide that also to the call center, and that way all the calls that are coming out can be filtered, whether they're going MIP, Medicaid, SNAP, TANF, aid to the totally disabled, and aid to the blind, and so forth. So we'll get that. I'll have Jess. I'll call her as soon as I'm done with you, and I'll have her segregate all that out. So
can you just numbers? Give her my number, and then we could, because what I want to do is I want to get her on, and let's say, so how much do I qualify? How much do I got to make? How much what are all the qualifications, so that people know whether or not they should bother applying.
Not a problem. I'll give her your number as soon as I get off the phone.
Thank you, Linda.
Because I'm on my way to another meeting.
Okay.
Thank you so much.
Thank you, Linda.
Thank you.
Bye-bye.
Be safe.
God bless you. Wash your hands. All right. Linda and Pinko, DeNorcy, of course, Public Health, Social Services. Man, I had a comment here. I didn't see it in time. What happens to those who recover? Should they retest them to make sure they test negative before sending them home? If that's what they're doing, because I read somewhere that they can still test positive after they recover. Well, yeah, if we all have it and you recover, I wonder, though, if that's something we haven't been able to get an answer to. If you have it and then you go out, can you catch it again?
You can ask that question in the press conference today.
Okay, good.
Or something else.
All right.
knows.
8:46. So that's Linda. Did you have anything to go over?
No.
Okay.
Just no.
Stay home.
Mask up.
Wash
your hands.
We talked about this yesterday. While they figure out who's got the authority, just know that we have the power to lock ourselves down. So